Good afternoon. My name is Princess Francois, and I would like to first and foremost thank you so much for having me. It's a pleasure. I am also a resident of the state of Massachusetts and also a student at the Regis College of Nursing for their doctorate in nurse practitioner. I also am an RN. I worked at the Brigham and Women's in Faulkner Hospital in Boston. I am also a member of the Massachusetts Nursing Association. And as a member, I would like to represent our organization and I wish to revisit the bill, House 2257. It is an act to improve and encourage, but mostly to improve the level of availability of nurses in medical facilities. This bill is essentially very important to me, and I'm sure it's most very much important to a lot of nurses out there. The bill was first authorized by the Executive Office of Health and Human Services under the Department of Public Health to create nursing scholarship for students in an accredited nursing school. But it is also an hopeful way of employing people to enroll in nursing programs because it guarantees them a coverage of the entire cost of school to cost of school, whether they're getting their associate in nursing or bachelor, but hopefully bachelor in nursing. It covers up their student cost, such as the school fees or cost of school or books or anything like that. It basically cover up any educational costs for them. But this is where it's cashy. By covering up the cost, the students are then obligated to be retained post graduation. The reason why this bill and I and the organization, we as an organization feel that this bill should be revisited is because of recent things that has been going on. I work at Faulkner Hospital, and I will tell you that it is absolutely improper to have a nurse take care of one patient, one nurse to seven patients. It's just not. It's not ideal. You cannot give the patient the best of care. And one of the things we're taught is patient-centered care. How can you offer a patient-centered care to a patient if you are responsible for taking care of six other patients, or let's just say in a long-time care facility? How can one nurse take care of 15 patients? It's just not ideal. However, you can't really blame organizations nowadays or healthcare organizations because with COVID-19, a lot of nurses lost their life. So facilities, hospitals lost a lot of nurses, either due to early retirement or due to loss of life during the pandemic, or just fear of the pandemic drove a lot of nurses to other professions that doesn't even involve nursing. House Bill 2257 is a remedy. It is a remedy because it provides nurses for medical facilities. And these nurses, they're obligated, they're based, they're retained because because this bill will cover up the cost of their school. So in return, they're going to be retained. Um, like I said, we would really love for this bill to be revisited. We would really love for the House to take a look at the bill again because recently the state of Massachusetts has been employing travelers to come in and fill up the gaps. There is no With this bill, you're basically planning for a solution for the future. So that way we are not so desperate to have travelers come in and fill up the gaps and fill up the gaps. And also by revisiting this bill, you're also creating a platform of safety for patients. Increased workload, stress, shortages of nurses. It's just not a healthy thing for nurses that are working currently right now. Psychologically, it's draining. It's just draining them. So this bill is very, very important, and I would love the House to revisit this bill, to take a look at it again, and I will really love it to be something that will eventually be passed. We again from the Massachusetts Nursing Association, I would like to thank you so much for taking all the time to listen to me. Thank you. And if you have any question, I am all ears. Thank you.